What is a congenital hip dislocation? What this is when you are born, the ball is out of the hip socket. So how is it diagnosed? Well, your pediatrician will perform an exam on your new baby. They check the hips. When they check the hips and they feel that something's a little bit off, they'll perform an ultrasound to confirm the diagnosis of hip dislocation. Sometimes the diagnosis is not during the newborn time period, and other ways that it can be diagnosed is maybe there's a significant limp, or when you go for repeat exams with your pediatrician, they may notice one leg is longer than the other. Your pediatrician will be able to check at each well-child visit to determine whether or not your child has a hip problem. How is a congenital hip dislocation treated? Well, we have multiple options, and the options depend on the age of the child, when it's diagnosed, and how severe the dislocation is. In infancy, we will typically treat the child in a Pavlik harness. And what this does is it positions the leg so that the hip joint relocates, puts the leg deep down into the hip socket, and they'll wear this harness until the hip normalizes. So you get a deep socket, a well-located hip, and then a normal hip throughout adulthood. We're really looking forward to meeting you and your child when you come for a visit.